There are about 95% completed staff accommodation here at the European hospital, which has been abandoned since 2017, was just the first phase of a total project that was actually going to see the second phase also coming up with the infectious disease center. But because it has been halted, we don't even know whether the second phase will actually come to fruition. For City News, I'm Akwasi, Annim, Takoradi.
So there you have it, our colleague Akwasi Agyei reporting from Takoradi, and we have to get to a point where we address the premium we place on human lives in this country. Every citizen is entitled to their right of life, which means that under no circumstances should a Ghanaian die because they ended up in a hospital that does not have the resources. As you can see there, the health workers are committed to saving lives. Even though they don't have enough resources, they get up every day to do the best they can. The barest minimum we can do as a country is to resource them well, now more than ever, so that in case someone who has a pre-existing health condition contracts coronavirus or anything at all and ends up in a facility like that, chances of saving their lives will be high. We have our correspondent Akwasi Agyei on the line. He's going to show us the current state of this project. Good morning, Akwasi.
Hello, good morning, Jifa.
How are you?
I'm fine, Jifa.
Can you tell us what's going on?
Well, Jifa, as you can see, I've actually made it back to the European hospital, also called the Takoradi Hospital. And as you can see, the structures are in the same state as we came here several months ago. And my checks with the hospital authorities indicate that the Parliamentary Select Committee on our health and infrastructure made it here a week after we did the first report and gave promises that the contractors will come to site. But several months down the line, the situation is still the same as we came to see in our first report. The facility is supposed to actually provide accommodation for existing health staff and the house spent doctors who were actually supposed to have come here to train, and in the process of training also beef up the health capacity, the health staff capacity over here. But as we speak, the hospital didn't have that privilege of hosting them because of space. Again, talking to the medical superintendent, who doesn't at the moment want to speak because of victimization, he's telling me that several of their staff are also struggling with accommodation because of this project, which has actually been halted for no reason. And so, as we speak, that's the situation over here. We've tried to get answers from authorities who should be answering to these things, and it's been very difficult. The Metro Chief Executive, as you know, is no more, and the regional minister is the one acting. We've tried severally to get him. We didn't get any answers. So, as we speak, this is a situation. Not too much has changed.
So we'll get to the authorities who are supposed to respond, but how are the health workers feeling? This must be very frustrating for them.
It is. I mean, I've checked, and some of them who are lucky to even have existing, or should I say, old quarters for the accommodation, those structures are in very bad shape. And so they were all hoping that when this thing comes to stream, I mean, it's completed, they could also get a chance to move in. And what even pains most of them is that they need more hands at the hospital. And for them to actually have this project halted, it means they wouldn't get the needed hands to come because they wouldn't have any place to actually accommodate them. And so that's the feeling across, I mean, the staff that we talked to.
Now, beyond the accommodation issue, you said they were supposed to have some sort of new emergency block to assist them with their work. Can you tell us more about that?
I must say, this emergency structure, as you saw in the footage that you played, was actually commenced a little before the CAN 2008. That's the African Cup of Nations in 2008. And it was meant to actually be the center for emergency within the metropolis. And they were doing everything to complete it before the CAN 2008, but it's halted. And the last time I came to talk to the medical superintendent, I was told that because of the many years the structure has been left, it has become dangerous for them to even continue, even if there's available money, and they will have to pull it down before they can reconstruct. So it's been abandoned, and it cannot be even continue if the money is available, unless the whole work is actually brought down.
Akwasi, I know that the authorities refuse to speak to us, but what impact will completing this project have on the community from where you are?
The first thing is that workers who must actually have a good place to sleep, that is the health professionals who have to have a good place to sleep and come back in good health to actually come and deliver, their outputs will be challenged because they wouldn't have the sort of energy that they need. Again, if the facility is ready, it means they can actually attract more personnel to come in and work here so that the turnaround time of people who actually come here to seek health care can be quicker. Because when you don't have much hands taking care of the complaints or OPD cases, consultancy and all that, people will come and will have to wait in queue because there are few people offering consultancy services at the hospital. And so definitely healthcare delivery in general to the people will be challenged.
Thank you very much, Akwasi Agyei, Annim, for being with us.